Salimuddin Khomesa. He is a program coordinator from National Pharmacovigilance Center, NIAM, Bangalore. Sir का topic है Materiovigilance in Unani medicine. Please, sir, proceed your lecture and kindly share your PPT with us. Thank
you. Adab, Assalamu alaikum. Good afternoon to all of you. Is it that entire screen is visible?
Yes, sir. Yes, sir.
Yeah,
Yes,
thank
sir.
you. Thank you, Dr. Sir. Thank you, doctors. Thanks for inviting me to part of this virtual meeting in dissemination of the knowledge, particularly the topic what I have selected to discuss is the materiovigilance in Unani medicine. Is it as a pretext? I have some of the interesting things to be discussed. Probably you've been able to see this. According to a recent study conducted, when we pour hot tea or coffee in a paper or a plastic cup, जनरली हम चाय तो ऐसे जहाँ कहीं पे भी कोई चीज मिल जाए, चाय का मामला ऐसा है कि वी आर नॉट वेरी प्रोटोकॉल फॉलोअर्स. चाय पीने की अगर हाजत हो जाए तो ना प्लास्टिक के कप में भी पी लेते हैं, पेपर कप में भी पी लेते हैं. Is it right, sir? And now the study says that this paper and the plastic cups, when you pour this hot tea or coffee into that one, the tiny plastic particles on inside the surface of the cup get dissolved with the drink as what you're going to intend to drink. That is making it highly contaminated and harmful for one's health. So I'm just taking all of your attention towards the topic materiovigilance. This is a very basic perception because all of us are one in another way. We used to take tea and coffee sometime in a paper cup or the plastic cup. Do understand the hazard associated with this. If you leave this hot tea, coffee for a long time into the cup, the chances of getting dissolution of these plastic particles are there, which may prove to be very harmful to our body. Adding another information, most of the people are habituated to use talcum powder because the talcum powder contains a mineral talc. This is one thing. This is a talc, and if this mineral talc gets under your skin through an open wounds or gets into eyes and some of the orifices, sometimes it may lead to a lot of problems. And it is evident that it could cause irritation and redness in the skin and eyes, and is also not considered to be healthy. And now I'm just talking about the contradictory function of the talcum powder. Probably you would have heard about this. Another important even what we have observed is people who have been operated immediately or after hernia surgery, patient reported some adhesions. This is people who have been treated with the post hernia surgery where mesh has been introduced into them. They reported a chronic, consistent, persistent adhesions, bowel obstruction, infection. Sometimes it leads to mesh failure and recurrence of hernia. Adding one more important information, there is a person by name an orthopedic surgeon, Stephen Tarr, orthopedic surgeon. He himself undergone metal on metal hip implant. He had a problem with the hip. Dr. Munshi, yeah, so metal on metal implant. He developed tremors and mental health crisis after some point of a time. Later learned about that his cobalt level increases disproportionately, that is more than 100 times than the normal level in blood and urine. It was the increased cobalt level was responsible for the manifestation of neurological problem. This is a case of his orthopedic surgeon. He himself had a hip problem. Hip replacement was taken place and the hip was made up of metal upon metal implant. As a result, there is increased cobalt level in his sugar, that is in blood and urine, that causes the manifestation of this neuropsychological problem. Taking you to another more important information, there is Johnson & Johnson's replacement hip device implant was available. People to whom they have transplanted the hip, they started facing the difficulty in walking. At some point of the time, they started visual problem and irregular heart rhythms also. Ultimately, the scientific community fraternity observed that the people who have started complaining after this Johnson and Johnson based replacement of a hip product is responsible for the manifestation of these symptoms, because this replacement hip is also contains metal on metal like cobalt, chromium, and molybdenum. That is the reason the case has been complained into the court. Finally, the product which is marketed by Johnson and Johnson was withdrawn from the market, and probably it was on 24th of August 2010. Out of several number of the people to whom Johnson and Johnson hip kit was transplanted, there was a recorded of 4,700 people, out of which 3,600 people data was not available. We were unable to trace them, how they are reacting to this implant. Hardly 101 people were detected with the post Johnson and Johnson replacement hip. The company, through the legal personnel, contacted all the transplanted person, out of which only 22 people responded. The reason of giving this description is these are the people who are subjected to the hip replacement, and they are suffered with a lot of a problem because of this, what is called the metal in metal that is used by during the surgery. Another example, one incident is Ucera is a product, basically is a coil birth control implant inserted into the fallopian tubes through uterus only. At some point of a time, the people who inserted this Ucera product, it resulted in persistent pain, bleeding per vagina, and unintended pregnancy. And sometimes it causes sterilization. Basically, this birth control product is used to prevent the pregnancy. But all the way once they have implanted, they started complaining of several complications. I hope out of these 5 incidents, you will be learning something about that. The teacup is a product. It's a substance made up, a physical substance made up certain material. Here I'm talking about the powder is also a substance made of certain chemicals. When they are in contact with the person, may likely to develop certain problem. Here in the hernia, mesh is a product which is used to correct the herniated portion, also causes certain problem to the people. In both the cases, here we have joint replacement, the hip joint replacement, and the substance used to replace was made up of metal in metal like cobalt, chromium, molybdenum, causes a lot of hue and cry among the patients. Finally, this birth control product also failed. All these things are directly or indirectly showing about the failure of some of the medical devices. The material which is used for some intention, but of that it works against the intention of use of this one. Let me take you the objective of my presentation with this brief introduction. Throughout this presentation, we are going to come to the conclusion why we are going to talk about this material vigilance is to promote safe use of medical devices like hip transplant. We know that the substance what they have used. I told you the mesh what we used in the surgery. So safe use of medical devices to monitor medical device associated adverse drug reaction, adverse events like chromium cobalt induces a lot of a neurological problem, and to create awareness among health professionals. This is today we are knowing something about the material vigilance. We are the healthcare professionals about the importance of medical device associated adverse event reporting, and overall to monitor the benefit risk profile of medical devices. Since morning, we are learning about the importance of the pharmacovigilance objective. Dr. Zahir has rightly told about that. As a physician, as a researcher, we have to focus more on providing more benefits to the patient and risk, very less risk in comparison to the benefit. And to generate independent evidence-based recommendations on the safety of medical devices. Like Madam Homera Bano was telling very confidently about the what is called the safety aspect of the Unani system of medicine, because it is very difficult to report ADR from Unani medicine because Unani scientists have taken all measures to control pharmacovigilance related activities, really. And ultimately, the objective of our presentation is to communicate the findings to all the key stakeholders. Here, the key stakeholders means all the healthcare professionals, including the manufacturers of their products. This is the objective of study. Let me take you a little bit more elaboratively pharmacovigilance and material vigilance, because RRUM Mumbai is one of the peripheral pharmacovigilance center. And now that today the awareness program as a national coordinator, why I'm going to focus about the material vigilance. Let us try to understand the importance and the relationship of material vigilance in the perspective of pharmacovigilance. I hope all of you know that pharmacovigilance is a science activity relating to the detection, assessment and understanding and prevention of adverse event or any other possible drug related problems. Here they included medical devices also. Not only the drug in the sense, not only the substance which is used orally or locally as in the form of some chemical substance, but apart from that, under this definition, some medical devices are also being included. Many more things are also there. So in this sense, these medical devices are basically the physical substances, materials. And now we are just trying to correlate this material with the material vigilance. Vigilance, all of you know that we are keeping, taking care of the substances of the material what we are using as a form of a medical devices. Basically, they are the physical substances and they're all non-pharmacological, but they don't have any pharmacology, the drug-like action. But based upon the functions, they may be different. Though likewise, in pharmacology, what we are going to do, the association of a drug, adverse drug reaction. We talk more about pharmacovigilance deals with the adverse drug reaction associated with the drug. Similarly, material vigilance is the one which is going to be deal with the adverse event associated with the medical devices used in day-to-day medical practices wherever it is required. So if you try to understand what exactly the material vigilance, inversely, this is the monitoring and safety of medical devices is known as material vigilance. I hope you will understand. Pharmacovigilance is only talking about the monitoring and safety of the drugs. Material vigilance is focusing more on monitoring safety of the medical devices which is used with the medical problems. Okay. अगर इसका definition समझने की कोशिश करेंगे, there are different versions of the understanding of a material vigilance, but I found very attractive definition here. It is material vigilance is the monitoring program which is organized by every nation dealing with the identification. First you find out, identify it, collect it, report it, and try to prevent the adverse events associated with the use of medical devices, along with its possible management to safeguard patient health. Here it is. Talking more about the medical device. Let us try to understand. हमने काफी कुछ समझा what is medical devices and now who is going to take care of this. Like Dr. Zaid has rightly told, pharmacovigilance program is a three-tier system under the Ministry of Ayush, where the National Pharmacovigilance Center is regulated to the intermediary, and intermediary will taking care of the peripheral pharmacovigilance center, which is pan-India available. Then at the ministry level, the program is being monitored. Similarly, the material vigilance program is also being monitored by, in India, the Ministry of Health and Family Welfare, Government of India, developed certain regulations, and these regulations are called as the Medical Device Rules 2017 that has been implemented from 1st January 2018. This is the regulation called as medical device, which is particularly being used in the country India. This is the regulation of 2017. In fact, prior to 2017, India was directed all these the objectives of the objects which is used in the medical field under the rules and regulations of the Drug and Cosmetic Act 1940. Soon after the introduction of this Medical Device Rule 2017, the Drug and Cosmetic Act 1940 has been replaced with this one. Okay, and whenever there is a new device came into the market, and all such new medical devices will be notified from time to time under subclass 4th of Class B of the Section 3 of the Drug and Cosmetic Act. मैं इस चीज को इसलिए कह रहा हूं कि recent past we have been come across with the pandemic. During the pandemic, the PPE is very common. PPE was very common. Now we have a description about the PPE in this notified from time to time. PPE is also considered as one of the medical device. So जो भी नई चीज medical device के definition में आती है, उसको timely Government of India इस medical device rules 2017 के इजाफे के साथ इस cosmetic and drug and cosmetic rule के section 3 clause B subclass 4 के तहत notify करती है कि these are all the medical devices. This is about the statutory issue. Let me take you exact understanding of the medical device. आखिर ये medical device है क्या? हम सब जानते हैं, लेकिन इसमें और कौन-कौन सी चीजें हैं जो medical device की ज़िमन में शामिल हैं. Medical device means the substances like the physical objectives, and their devices mean some sort of instrument. Their intention to use, we are collected these devices with certain intention to use either internally or externally for the purpose of either diagnosis, sometimes for the treatment, sometimes to ameliorate the changes, the mitigation or prevention of certain disease in human beings. यानी कोई भी चीज, कोई भी आला, कोई भी ऐसी शय जो क़सदन हम बैरूनी तौर पे, अंदरूनी तौर पे बदन इंसान के साथ उसका इंसाक करवाते हैं, गर्ज हमारी यही होती है कि वो तशखीस की गर्ज से हो या इलाज की गर्ज से हो या कोई तगय्युर तबद्दुल की गर्ज से हो या मजमूई तौर पे हिफ्ज़-ए तक़द्दुम के तौर पे जो इस्तेमाल की जाती है, उसी को हम मेडिकल डिवाइस करते हैं. ये इसमें वो तमाम चीजें शामिल है. It includes some of the preparation applied on the human body which intended to affect the structure or any function of the human body, like surgical dressing material. Sometimes what happens, a person met with a small accident injury and he will be provided with the surgical dressing. Here the bandage what they are using, the staples, sutures, ligatures, the disinfectants, sometimes the insecticides, mosquito repellents when we are using over the body or in a home to prevent this mosquito bite also comes under the category of the medical devices. Adding another important information, under the definition of the medical devices, substance other than food, सिवाय ग़िज़ा के, मासिवा ग़िज़ा के, वो तमाम चीजें जो बदन इंसान के लिए इस्तेमाल की जाती हैं, like syringes, blood and blood component collection bags also being defined as a medical devices, including something like a mechanical contraceptives, like for among the people of the reproductive age, use of condoms in male and women, intrauterine devices and the tubal rings. These are all comes under the category of the medical devices. And now my topic is material-vigilance, and material-vigilance is dealing with the material using for the betterment of the human people, and by the same time such a material should not have inherited adverse effects over the human body. That is the reason we are focusing upon the medical devices. Let us try to understand few more things. These medical devices could be technologically simple items like ice bags. I hope most of you people have seen the message Munna Bhai MBBS, that the man who is a faculty in the medical college who is teaching to Sanjay, the hero of the movie. Whenever that hero give trouble to the faculty, he started controlling his emotion, putting this ice bag over his head. I hope. Similarly, whenever we had the requirement, most of the people prefer to take ice bags to control the temperament of that area. Sometimes we need contradictory to the condition when there is a predominance of the cold thing, hard bags will be used to suppress the pain. Tongue depressors to examining the oral cavity. Sometimes the sophisticated equipments like cardiac pacemakers, proton therapies, MRI, CTs, and some softwares for the purpose of reporting these medical ailments or the things also comes under the category of medical devices. I mean to say there is a huge range of things are there, substances are there under the medical devices category. And I know these medical devices based on functions, and now they're based upon the function, they are different, they're classified into diagnostic devices. Some devices, some medical devices are meant for only diagnosis. Some devices can be used as an assistive. Like while doing the surgery, one suction instrument will be introduced to suck the substances, and the surgeon started doing surgical procedure with the help of scissors and the scalpel and all those things. Assistive care devices. Preventive cares are there. There some devices are there exclusively to prevent certain ailments, like the treadmill machine, exercise. Some equipments are used to control the body movement, the preventive. Therapeutic devices are there. There are certain devices exclusively used for the therapeutic purpose to find out the outcome of the product. In contrast to this, there is another group of what is called as medical devices based on use. They are classified into long-term use devices are there. Long-term, some devices which are used for the long time. According to the people who define this regulation, The long-term use devices are the use devices using for more than 30 days. And now, अगर हम इस बात को समझने की कोशिश करेंगे, this pacemakers are there, and some people, due to certain constraints, they have been kept on long euro bags, and some implants are there kept in their body, and those such things have to be kept for more than 30 days. Such items, such medical devices, if you are using for more than 30 days, that are mandatory to keep the person healthy, we will call them as the long-term use devices. The another time frame use of the medical devices are short-term devices, where they are not going to use not less than 30 minutes and not more than 30 days. Mean the range is between not to be less than 30, not to be more than 30 days. So here the device is using for a few days. Probably during the pandemic period, people have been kept on this oxygen ventilators, oxygen saturators are there. So that cannot be used continuously for months together. Only for a period of something like more than 31 or 2 hours. Once this respiratory levels have been established, again the devices will be removed from them. Sometimes what happened, for a small period, like transient use devices are also there that will be used for less than 30, like nebulizers, sprays, and many more things are there. So these are all the different type of a categorization and the classification of medical devices. As I told in the definition, any substance or device which is used for the purpose of treatment, diagnosis, and what is the mitigation, prevention. We have a list of diagnostic equipment like thermometer. I hope all of you, though thermometers, sphygmomanometers, stethoscope, hammer, tongue depressor, these are all the instrument used by all the system of medicine people. The diagnostic equipments what I have been placed before you, though predominantly used by the conventional medical practitioners, but it is not something like it is their proprietary equipments. These are the things open for all the people who are the healthcare providers, are the people who are dedicated to take care of the health of the public. So as a practitioner, as a person with science, as a physician of a particular Ayush system of medicine, I am going to use the thermometer as a diagnostic device to find out the temperature of the patient. I'm going to use the sphygmomanometer to record the blood pressure. I'm going to use the stethoscope to know the different sounds and the flow of these gases in the body. These are not the assets of any particular specialist. So in that sense, we are directly or indirectly using all these diagnostic equipments. This is nothing but they are the medical devices. Thermometer, hammer, tongue depressor, speculum for nasal vaginal examination, proctoscopy, octoscope, all around some 10-20 devices are there that are dedicated to use for diagnosis of any disease. Coming to the very important part of our topic, like material vigilance and Unani medicine, does really we have a medical devices Unani medicine? For understanding this, I would like to take your attention. Medical devices in Unani medicine, used Unani medicine, can be categorized based upon the treatment modalities. In our system, we have basically these are the three treatment modalities, that is ilaj bid dawa, ilaj bid tadbir, and ilaj bil yet, nothing but this is the jarahat. Okay, अगर हम इन तीन चीजों में ही हम मेडिकल डिवाइसेस को तलाश कर सकते हैं, उसी की बुनियाद पर हम इसकी दर्जाबंदी भी कर सकते हैं. Let us take you here in the drugs. I am going to focus more on the pharmacy Saidala part, because single drugs, as if it is available, that can be used as in the form of decoction, powder, anything will be. But sometimes when we need to go for compounding and to make more effective of the drug, like Dr. Humera madam was talking about, why we used to use Javarishat in the Durdura form, why we used to use the liquid form of the drugs, and there is a rationality behind the dosage forms also. If we wanted to enhance the activity of the drug, we need to provide them in a very instantaneously absorbable matter. So I have focused something more about the medical devices part, where how these people of Unani system of medicine focus on the material vigilance related to the drugs, and some regimens are there. That is a big curiosity of the people how this material vigilance is going to play. I kept aside this manipulative therapy surgery part because the time concern. Let me take you to this Saidala part, Ilaj Vidda pharmacy. I hope all of you know this Kharal, Havandasta, the mortar, the pestle, Silbatta, Channi, through which that we used to chant. Dabi, that's a type of a stick whenever we need to do some sort of a movement in the preparation. Maul Jubin ke liखा हुआ है कि आप जब मालजुम तैयार करते हो तो खजूर की लकड़ी की मदद से जुगन को अच्छे से घुमाया जाए ताकि वो अच्छी तरीके से मिल जाए. And no, in our satellite we have a device that is the jantar, different jantars are there. Patal jantar, Garb jantar, Jal jantar, Bodhra jantar, Teju jantar, Damru jantar, Doli jantar, Kachi jantar, Kachwa jantar. These are all different jantars and exerting a very tremendous effect in extraction of the drugs and making the drug more effective. So, like Harambi, this is one of the biggest device through which we are distilling the substance extraction. Atishi Shishi, which is helping in making the a fireproof bottle to make a combustion of the product. Nal Bhabka, that is Deg Bhabka, Nadi Jantar, extractions also we use. Bhuta, there is a crucible, this is Kushta Sazi mein use kiya jata hai. That is one of the best example, like the tandoori chai jaise बनाई जाती है इस तरह किया जाता है. Gile Hikmat is also a technique to make the something like a preparation. Kapiroti, Haman Maya, and all these are the different kinds of devices using for preparing the drugs that ultimately going for the betterment of the use for the human being. Or, to the best of my understanding, these are the medical devices only. And we are strictly monitoring and we are keeping a vigilance on the use of all those things. If you come to the part of the containers, what you use in Unani, that is utensils like kadhai, de, patila, and during the preparation of the drug, sometimes we wanted to make only to fry the products, we'll use a kadhai of different sizes, and they are totally prepared by metals. If these metals are not properly made to clean and a hygienic condition, sometimes it may causes what is called as a production of manifestation of what is that is what is called as the medical devices associated adverse events. Copper containers are we have, aluminum made containers have, and most of these patila they when are using long time, we need to coat this lead coating will be doing to the containers because there is a exerted action is there. What happened was sometimes this lead is disappearing from the layer of the container, the utensils. Will you imagine that the lead is a highly toxic substance? It itself is proved to be nephrotoxic, and at certain point of a time जिसको हमने खलाई किया जिन बर्तनों का वो जाया हो जाता है तो क्या where it is going. So before applying this lead to these containers patila deg, we are detoxifying this lead to the containers so it should not cause any harm during the preparation of the drug. And the modern pharmacy, we are habituated to use the modern pharmacy devices like distillation plant, pulverizer, mixer, shift. So all these cone blender, liquid filling machine, oil filters, these are all the modern tools where we are using in the Unani practitioners in preparation of the drugs. And all these are all the technically made devices. And these devices used for the preparation of a drugs for the human being. So according to the drugs and the medical devices regulation to 2017, around 351 items are being categorized under the medical devices, and all these 351 items have been rated based upon the risk associated with them also. Let me take you to other important thing is medical devices, dosage forms and regimens. Like मैडम ने जैसे बताया कि जिसमें कुछ अश्काल अद्विया होती हैं और चंद अमराजों में इस्तेमाल किए जाते हैं, जैसे शक्ल अश्काल अद्विया जिसे डोसेज फॉर्म्स ऑफ द ड्रग कहते हैं, गाजा, गालिया, उबटन, जिमाद, मरहम, केरुती, तिला, ये तमाम चीजें ऐसे हैं जो सिर्फ बदन इंसान को एक्सटर्नल तौर पर इस्तेमाल करते हैं. इसकी अफादियत यह है कि मुकामी तौर पर असर करती है, इससे फायदा लाभ होता है, but at the same time sometimes it may causes manifestation of adverse event also. डर्माटोलॉजी, कॉस्मेटोलॉजी में इसका बड़ा रोल है. आई एम जस्ट ट्राइंग टू रिकॉल यू, मैं आप लोगों की तवज्जो इस डेफिनेशन पे ले जाना चाहता हूं कि मेडिकल डिवाइसेस के डेफिनेशन में वो तमाम चीजें हैं जो ह्यूमन बीइंग्स की बॉडी पर एक्सटर्नली इस्तेमाल किए जाते हैं और ये तमाम चीजें लोकल फंक्शन पे मुतासिर करते हैं. सो द गाजा, गालिया, उबटन, जिमात, मरहम, केरुती, तिला, विनोश, हमें पता है कि इन तमाम चीजों का मकामी तौर पर इस्तेमाल करने से कुछ ना कुछ फायदा लाभ होता है. So these Gaza, Galia, Ubadan, they are the medical devices according to the definition with the reference to medical device 2017 rule. Similarly, some of the products using in hair care like Sibach, skin dye, hair dyers, skin dye that's for pigmentation of the skin, we use some coloring agents called the Sibach, Khizab over the hairs, Noura to remove the hairs. These are also a kind of dosage forms, but they redefine it as the medical devices according to the 2017 medical devices regulation. Some preparations which are used in the eyes, though they are the drugs dosage form, route of administrations only, but the definition of this regulation 2017 of medical device says that the products and Unani like Barood and Kahal and Khatur are also medical devices pertaining to the eye products. Some of the important products like which use in the genital and the anal area like Humul, Farzaja, Shiaf, Fatila, Hukna, they're all the devices only. Particularly, I would like to take focus of all the audience here. Hukna, Enema, Ayurvedic people, they have different kinds of vasati, and all the vasati, they have different equipment. The equipment used to indent this property is nothing but the medical device only. Madam was talking about the Farzaja and Humul also. क्योंकि उसमें कुछ दवाओं के महलूल को बनाकर इसको दाखिल किया जाता है. This is true. Basically, the Farzaja, Humul, they are the either it is a cotton or the cloth material. They're dipped in certain medical products, and with some of the creams like Marham Dakhilun Madam keh rahi thi, this is true. And now they are the medical devices carrying certain medical substances over the particular area to exert the function. So with this, I can say that Unani system, we had a very wonderful description of the medical devices in the form of Ashkal Adviya. दवाओं के बाद जो दूसरा तरीका इलाज हमारे पास बड़ा बहुत राइज वक्त है वो इलाज भी तदबीर, जिसमें सरफहरिस्त मेरे नजर में है फर्स्ट के मुताल्लिक, जिसे हम सब इसको विनेसेक्शन के नाम से जानते हैं. बदन इंसान में कुछ चुनिंदा रगों का जिक्र किया गया है. एंड नो फर्स्ट के लिए जरूरी है कि एक शार्प एक सर्जिकल इंस्ट्रूमेंट यूज करते हैं, जैसे स्काल्पेल कहिएगा या कुछ स्कारिफाइंग टूल्स की, जैसे अतिब्बा ने उसे नश्तर कहा है. एंड फॉर गिविंग द इंसिशन द साइज एंड द लेंथ एंड द volume and the structure of the nashtar, different instruments have been defined by the atibba, and all the different devices are medical devices only. Just the Raisha, Nashtare, 3-4 नाम है. I'm unable to recall those things. We have a very good description. अगर कहीं बारीक होल बनाना हो किसी रग पे तो नश्तर बिल्कुल छोटा वाला होता था, अगर वसी होना है तो कुछ चौड़ा वाला होता था. So like that, we have a very beautiful description of these devices for venesection. सर्जिकल ड्रेसिंग मटेरियल, क्योंकि फर्ज का अमल के फौरी बाद सर्जिकली इसको ड्रेस भी करना पड़ता है. उससे कम बाद वक्त ये होता है कि उसको इसकी पैवतकारी सीना भी पड़ता है, जहां मटेरियल भी इस्तेमाल होता है. गॉज, डिसइंफेक्टेंट मटेरियल, ये तमाम चीजें जो फर्ज के जीवन में बताई गई हैं, every individual entity is being considered as the medical device, and all medical devices should be monitored thoroughly about its any inherent adverse effect reaction. And the most passionate tadbir throughout the world nowadays, particularly among the Unani people, is having a hue and crow is this hijama. And we are happy. National Institute of Unani Medicine is conducting one special program for the very privileged kind of a deserving people in this hijama under this what is called the Skill Development India program. A hijama इलाज की तदबीर काफी शोहरत लाया हुआ है. Of course, this has some what is called this instinctual benefit with this procedure. Basically, hijama में जो material इस्तेमाल करते हैं, if you look at the time frame, initially the people started using the animal horns, followed by, based upon the indigenous sources of the material, somebody started using the local indigenous products like bamboo, clay material, ceramic pots, metal, plastic. Nowadays, silicone cups are also coming, and all these things and many more. Some of the instruments are attached to the suction machines also, because we have to need to go for this inducing the negative pressure. And for hijama bilshut, need to go for the scarification. We need some scalpels, blades, gloves, dressing material. Above all, pre and post disinfections. Any substance used to prevent infection. From here to here, all these substances are medical devices. That's there in hijama. And Mahajama Nariya, this is another variant of hijama, where that negative pressure will be created inside the cups with the help of a fire. And the cups will be of a different, either it could be a glass cup, maybe the bamboo cup, or silicone cup. Ultimately, the fire has to be introduced into this. This is igneous material, whatever it could be. There's a cloth, metal, spirit, alcohol, fire, anything should be placed inside this Mahajima under the cup. And here I have a understanding that any material of igneous substance is also a material, and this is a device. And the cups, obviously, they are the medical devices only. Mahajima. Risala, this is a wonderful point here. Risala stands for the leaching. There are different types of leeches. There is poisonous and the non-poisonous. Generally, for the purpose of medicinal importance, physicians are recommended to use non-poisonous leeches. Throughout the history, if you look at some hundreds of years back, there was a huge use of leeches for different beneficial effects. Food and Drug Administration, United States of America, on 24th July 2004, declared leeches as the medical devices, keeping the importance of the use throughout the history. And moreover, this FDA have given permission to one of the pharmaceutical, this one industry to go for the leech culture also. This is wonderful. We have a good description in Unani medicine about the use of the leeches with reference to the Indian physicians' data, what they have given about this safety aspect also. If you are using any this is poisonous kind of leeches, then more chances are likely to develop this what is called as a material-vigilance related issues. Yeah. Hammam is a classical bathing system. Basically, this depends upon 3 different rooms of different variant temperatures are there, but these rooms are being regulated with the thermal energy. The energy, we don't know how they are going to buy it, is electrical one or any mechanical thing there. But in the past, a Holocaust system used to be done through which there is a combustion will be created and this thermal energy will be produced, and this thermal energy will be available in specific room of the hammam, and this is a wonderful method of istafrag. So ये मेरे हिसाब से जो सब्सटेंस यूज किया जाता है हमाम में ताकि उसके हिफाजत के लिए किया जाता है, वो भी मेडिकल डिवाइसेस में शामिल किया जाएगा. Amalekkai, this is a cauterization, wonderful technique with the beautiful assured what is called as the benefits, where generally the cauteries are made up of metallic substances, metal use इस्तेमाल करते थे, but Atibba ने focus किया है कि the cautery should be of very good if you use the gold prepared one. Now we are introducing the instrumentation which is made up of gold, sometimes silver also, but silver cannot be tolerate heat. So better to have this gold because this is a disinfectant, it won't cause transmission and infection, and it's a good cautery also. So जिसके नाम से कहा गया है. This is also a medical device according to my understanding. दल्क में मसाज किया जाता है जो मैनुअल स्ट्रोक के थ्रू किया जाता है, where we use different external application of substances, oils. तो बहुत सारे ऑयल्स हैं जिसको शायद मैं समझता हूं उसको भी मेडिकल डिवाइसेस के डेफिनेशन में लाया जाएगा, दो दे आर दी डोसेज फॉर्म्स ऑफ द मेडिकल प्रोडक्ट्स. तकनीक कहते हैं फर्मेंटेशन को. यहाँ में 2 तरीके की तकनीक मिलती है, ड्राई और वेट भी. ड्राई में मखसूस किसी मादे का इस्तेमाल किया जाता है जिसमें रेत, नमक और कोई खुश्क दवाई भी हो सकती है. वेट में चंद जोशानदे और चंद चीजों की दवाओं के महलूल से बना के किया जा सकता है. And the preparations made up of the dry substance or the wet substance for fermentation. Fermentation is a process only, but the material what they are using is the medical devices here. Khasati, we have a very wonderful description of the catheterization. In the classically we have the definition of the catheters of made up of metallic one, followed by rubber. Now polymer materials are using in the use of khasatis. And ribatats are there, means something ligating substances, the bandages. We have a description of saduratraf, जहां कहीं किसी का कसर खला होता है तो अतिब्बा ने उनको बांधने के लिए कपड़ों की मदद से चंद शक्ल के चीज बनाई जाती थी जो कपड़ों का बना होता किसी और चीज का, जिससे मरीज के हाथ जिसका कसर खला होता था और कोई किसी अज़ू को उसके अपने वजह पे लाना हो तो इनका इस्तेमाल किया जाता था, जिसे हमने बैंडेजेस कहते हैं. इसके अलावा एक तकमीत हमने पढ़ा हुआ है तदबीर में, जो अमूमन 9 मौलूद बच्चों में उनके आज़ा और अहशा को बांध के रखने के लिए एक कपड़ा उनको बिल्कुल टाइट से बांधा जाता है. That is also one of the medical devices recommended. अमल बज़ल जिसे पैरासिंथेसिस कहते हैं, अमूमन जहां बदन के अंदर कोई गैर तबी मादा जमा हो जाता है तो उसको खारिज करने के लिए अतिब्बा किसी जगह पर नश्तर लगा के एक छेद करके वहां से मादे का इखराज करते थे. तो जो इंस्ट्रूमेंट यूज करते हैं जिस मकसद के लिए वो भी मेडिकल डिवाइसेस था जिसका तस्करा तिब्बी यूनानी में मौजूद है. अलावा चंद तदाबीर जैसे इनकबाब, लखलका, बखूर, नतूल, सकूब, गसूल, आबजन, पाशो या जरूर, ये तमाम चीजें मुख्तलिफ तदाबीर के ज़िम्मन में बयान की गई हैं. है तो ये अशकाल अदविया, बट ये इंफरादी तौर पे मेडिकल डिवाइसेस की हैसियत रखते हैं, लिहाजा इनसे पैवस्ता, इनसे मंसूब कोई भी अगर कोई एडवर्स इवेंट हो तो उसको भी मटीरियल विजिलेंस के ज़िम्मन में शामिल किया जाएगा. फिजियोथेरेपी की चंद टेक्निक्स लाइक टेंस थेरेपी, अल्ट्रासाउंड थेरेपी, शॉर्ट एंड लॉन्ग वेव डायथेरेपी, फोटोथेरेपी, अल्ट्रावायलेट थेरेपी, वैक्स थेरेपी, क्रायोथेरेपी, लेजर थेरेपीज, ये तमाम थेरेपीज भी चंद इक्विपमेंट से जुड़े हुए हैं. दे आर आल्सो गवर्न अंडर द रूल्स ऑफ मेडिकल डिवाइसेस 2017. अब तक मैं जिन चीजों का तस्करा किया था इनसे वाबस्ता मुमकिन है इनसे कुछ रिस्क हो, तो इंडिया में खास करके
ना हम ई भूखे सुतल करल भलार गाल बड़े मामू खाना टाइमिंग से खाते हैं। हाँ
Kindly please mute your phones.
based upon the risks associated with the medical devices in India, the regulation classified into 4 classes, class A, B, C, D. अब समझने की कोशिश करिएगा कि क्लास ये मेडिकल डिवाइसेस कौन होते हैं। मीन ऐसे मेडिकल डिवाइसेस जिनके इस्तेमाल से बड़ा रिस्क बिल्कुल कम होता है, ट्रांसिएंट यूज करते हैं, बहुत कम मुद्दत के लिए इस्तेमाल करते हैं, या लंबा भी इस्तेमाल करें लेकिन उससे कोई रिस्क साबित नहीं होता। जैसे बैंडेजेस, किसी जख्म पे अगर किसी को बैंडेज कर दें तो इससे कोई रिस्क नहीं है। हिजामा में जो रबर कप इस्तेमाल करते हैं उसके इस्तेमाल से, पीपीई इन दिनों काफी इस्तेमाल किया गया, किसी को कोई नुकसान तो नहीं हुआ है। अगर बहुत लंबी मुद्दत तक ऐसे बांध के रखे तो मुमकिन है लोगों में ये देखा गया कि पसीना जमा हो गया जिसकी वजह से स्किन इन्फेक्शन आ गए हो, बशर्ते कि फ्रीक्वेंट यूज में हो, ट्रांसिएंट यूज में हो, तो शायद देयर आर ग्लव्स के इस्तेमाल से भी, बिकॉज दे कैरी वेरी लेस रिस्क। Any medical device using for a short span of a time, transit less than 30 or between 30 to less than 30 days, 1 or 2 days, they fall under the category of a class A medical devices, and all such devices carry low risk only. इसमें कोई घबराने की बात नहीं है। हमारे पास बहुत सारी चीजें इसमें शामिल हैं। Let me take you to the class B category के जो मेडिकल डिवाइसेस हैं, they carry low to moderate risk है इनके साथ, जैसे डिसइंफेक्टेंट्स हैं। डिसइंफेक्टेंट में हमने हमारे पास तो मतलब देखिए कन्वेंशनल साइंस से जुड़ी हुई डेटॉल, सेवलॉन और बहुत सारी चीजें मौजूद हैं। अगर हम अपनी तरफ की बात करेंगे तो मुश्किल से कई ऐसे पौधों के जोशांदे बनाए जाए या तो सिरके को इस्तेमाल किया जाए, डिसइंफेक्टेंट के तौर पर इस्तेमाल किया गया हुआ था, लेकिन इनसे जुड़े हुए कुछ रिस्क जुड़े हुए हैं। एंड ये भी बताया जाता है कि डिस्पोजेबल हाइपोडर्मिक नीडल्स जो हम किसी इंजेक्शन के लिए करते हैं या बदन के इंसान के अंदर किसी चीज को दाखिल करने के लिए, कोई रुतूबत को या बदन से कोई चीज को बाहर लाने के लिए, मेडिकेशन इंजेक्टर, डिस्पोजेबल सिरिंजेस, आईवी कैनुलास, कॉल्पिन सेट्स, इंट्रावेनस कैथेटर, ये तमाम चीजें इंक्लूडिंग सर्जिकल ड्रेसिंग्स जिसमें सर्जिकल स्टैपल्स हो, नेजल ऑक्सीजन कैथेटर और हिजामा महाजिम नारिया में जहां पे सिंगी, ग्लास और बाम्बू जैसे चीजें अगर इस्तेमाल करते हैं तो ये और मजीद बहुत सारी चीजें हैं जिनसे थोड़ा सा रिस्क शामिल है, जिनको हम क्लास बी में शामिल करते हैं। मीन वी नीड टू फोकस मोर ऑन दिस मटेरियल विजिलेंस पॉइंट ऑफ व्यू से, इस पे हमें खासा तवज्जो देना पड़ेगा क्योंकि यहाँ मॉडरेट, लो से मॉडरेट रिस्क शामिल है। मुमकिन है इनके इस्तेमाल से, जैसे सिंगी के, बाम्बू के, ग्लास के टूटने से कुछ खतरा हो, आईवी कैनुला के मिस हो जाने से रप्चर हो जाए, एंड यहाँ मेडिकेशन इंजेक्टर से कोई दिक्कत आ जाए, डिसइंफेक्टेंट के लोकल एप्लीकेशन से शायद कोई स्किन इरिटेशन हो, कोई एलर्जी हो, तो लिहाजा वी हैव टू फोकस मोर अपॉन द यूज ऑफ दिस प्रोडक्ट्स। क्लास सी के जिम्मे में जो प्रोडक्ट्स आते हैं वो मॉडरेट हाई रिस्क है, लो से मतलब ज्यादा किसी कदर ज्यादा मसला है, जैसे कॉन्ट्रासेप्टिव्स जो अमूमन लोग यूज करते हैं, जैसे ट्यूबल रिंग्स, फेलोपियन रिंग्स, जिसका मैंने एक एसूरा का जो रेफरेंस दिया था वो दैट वाज फेलोपियन ट्यूब ब्लॉकर्स, जिसके नतीजे में काफी मसला शामिल हुआ था। एंड डेंटल इम्प्लांट, आई थिंक हम में से बहुत सारे लोग ऐसे होंगे जो दांतों के खराब होने की वजह से या तो सीमेंटिंग करवाए हों या तो उस पे सेरामिक इम्प्लांट कराए हुए होंगे, बिकॉज इंटरनल प्रोस्थेटिक्स आल्सो समटाइम कॉजेस सम प्रॉब्लम। मीन मॉडरेट रिस्क ऑफ डेवलपिंग सम ADRs are there, adverse events are there, intraocular lenses, because nowadays we are very passionate about the aesthetics. हम अपने आप को खूबसूरत बनाने के चक्कर में कन्वेंशनल ग्लासेस को खैराबाद करके हमने आंखों में अपने इम्प्लांट करवाए लेंसेस को। Of course, this is a very good with reference to the technology, but sometimes there is a inherent problems are there that may causes moderate high risks are there. This is not applicable to all the people. There are few people who are likely to have this kind of risk. हुकने की भी, हुकना जहां इस्तेमाल करते हैं उससे भी व्यवस्था कुछ मसाइल हैं, जैसे उसके दाखिल करना, मादे का अंदर दाखिल करने में इफ यू आर नॉट टेकिंग प्रॉपर केयर इट कैन बी, इट आल्सो गिव्स राइट सम मॉडर्न रिस्क्स आर देयर। वेरी हाई रिस्क्स में जैसे अमलक का कॉटराइजेशन है, आप क्योंकि यू आर डायरेक्टली प्लेइंग विद फायर आर सम एनर्जी एंड दैट कैन कॉज हार्म टू दिस। मेल कंडोम्स इंक्लूडिंग कॉपर टी, I got very few things are there. There are so many things are there which comes under the category of a D. ये बहुत जिनका लॉन्ग टर्म यूज करने की वजह से हाई रिस्क हो सकता है। There are so many things to be discussed, but because वक्त की कमी की वजह से हमें शॉर्ट करना पड़ रहा है। Finally, coming to the conclusion, medical devices are important part of the healthcare system. ऐसे दुनिया का कोई भी हेल्थ केयर सिस्टम नहीं है जहां पे मेडिकल डिवाइसेस इस्तेमाल न करते हो, एंड मोर ओवर बीइंग यूज्ड ऑल सिस्टम ऑफ मेडिसिन। As a Unani doctor, I am using Ayurvedic, Siddha, modern people also. But if you look at the usage, widely used in the conventional medicine and little less in alternative medicine. यहाँ मेरी मुराद आयुष के लोग हैं और दीगर लोग भी हैं. हम डायग्नोसिस के लिए भी करते हैं, ट्रीटमेंट के लिए भी हमारे मेडिकल डिवाइसेस को यूज करते हैं. खरीबल क़ियास मोर देन 1 मिलियन मेडिकल डिवाइसेस का तस्करा है, जिसमें बैंडेज, टंग डिप्रेशन, जैसे हमने बताया, एमआरआई भी है और कई मेडिकल सॉफ्टवेयर भी शामिल हैं. लेकिन इन मेडिकल डिवाइसेस की बेनिफिट्स के साथ, with the benefits of the patient, but at the same time they also carry significant potential risk, as I told you. मेडिकल सॉफ्टवेयर से तो कोई मसला नहीं है. कॉटरिंग हमने बताया, कैथेटर्स की बात बताई हमने. ऐसे कुछ और दवाइयां हैं जिसके इस्तेमाल से गलत हो सकता है, जिसके नतीजे में रिस्क भी हो सकता है. लिहाजा इट इज नेसेसरी फॉर ऑल ऑफ द दिस, लाइक फार्मास्यूटिकल प्रोडक्ट्स, ड्रग में क्वालिटी ऑफ जिस तरह मॉनिटर किया जाता है, इसी तरह क्वालिटी ऑफ मेडिकल डिवाइसेस को भी मॉनिटर करना चाहिए टू एंश्योरिंग द सेफ्टी, एफिकेसी एंड सेफ्टी. एज अ रिजल्ट देयर इज अ नीड ऑफ मटेरियल विजिलेंस came into existence, and Unani medicine was well versed with the use of materials and their quality maintained throughout the history. Of course, I am in consonance with the state of Dr. Humaira Madam ji. हमने बड़ी जो ठोक के कह दिया था यूनानी में फार्माकोविजिलेंस की गुंजाइश नहीं है, लेकिन है. फिर भी जहां कहीं भी हो रहा है, मुमकिन है वो किसकी गलती है? प्रोडक्ट से जुड़ी हुई है, या मरीज के इस्तेमाल से गलती हो रही है, या माहौलियाती असरात से मुताल्लिक हो रही है. इस पे हमें तवज्जो देना चाहिए. So I say Unani is rich of material vigilance, but at the same time we need to be very careful in monitoring the material vigilance of the thing what we have in Ilaj bi Tadbir and Ilaj bi Dawa. Thank you.
Thank you very much, sir, for your presentation. It was very nice and wonderful, expressing the new concept of material vigilance.